Elective surgeries can start again. It is part of the move to get Texas reopened by the governor. Governor Greg Abbott's order goes into effect today. But Molly Oak tells us there are guidelines for when these procedures are allowed.
Lately, it feels like we are putting life on pause.
It's been a crazy time.
And Dr. Shaun McKenzie is in a field where time can make all the difference.
Some of the cancers that we treat have been felt to be not as acutely life-threatening as others, although we can say that, but the patient who has that cancer would not necessarily agree with us.
He's a surgical oncologist with Texas Oncology who is happy to hear some elective surgeries are back on the table thanks to Governor Greg Abbott's order.
It really pulled the hospitals back in and said if the hospital is responsible to determining if they have the resources and if they have the bed availability and they have the safety components in place to proceed with elective surgeries. And I think that that's important.
Especially for the patients who find out they have cancer.
Once you get that diagnosis, I think all of us would want treatment to start yesterday.
Even if it's an early stage cancer diagnosis.
We feel it's low risk, and so you're excited, and then that's followed out with, so it's probably going to be 30, 60, 90 days before you have your curative therapy.
And on the other end of the spectrum?
And then another patient hears, so you have a cancer that's mortality rate is dramatically high, and so we're going to take those chances, and you're going to the operating room next week.
Now, doctors don't have to decide which patient can afford to put off surgery. There's no more pressing the pause button, so the potentially life-saving surgeries can start. Molly Oak,